Hi, it's Dr. Kevin, author of the Hypothyroid Diet. Did you know that 70% of thyroid patients that are medicated still have symptoms? Now, one of the reasons for this is that there's an underlying problem, meaning that your thyroid will present itself as having issues, but really there's something else causing these thyroid issues. And one of the most common things that occurs is adrenal fatigue. So you may have adrenal fatigue, yet your body and your physician think that there's a thyroid problem, because what happens is you have a stressful event in your life. For instance, if you lost your job, if your house burned down, if you lost a loved one, you got sick, these are traumatic events in your life that will cause a lot of stress, and it may cause your adrenal fatigue and tell your body to start slowing things down. It wants to rest and repair itself. Ultimately, this will basically downregulate your thyroid, so your physician will look at your thyroid blood test and say, hey, there's something wrong with the thyroid. But in reality, it's your adrenal glands causing the slowdown. So what happens is your physician will give you thyroid hormone replacement. And what that does is it raises the metabolic rate, when in actuality, your body just wants to slow down, repair, and recover. So temporarily, you will feel better. Symptoms will go away, yet eventually they will come back. So how do you know if you have an adrenal problem? Well, I wrote down some symptoms that are similar to hypothyroidism, but if we pay attention and look at them closely, we'll be able to determine the difference. So let's take a look at these really quick. So adrenal fatigue, body temperature. You know, hypothyroid patients have low body temperature, so does adrenal fatigue patients, But what we look at is the low body temperature, below 97.8, and it always fluctuates. Hypothyroidism, pretty steadily low. Eyebrows, full eyebrows and adrenal fatigue. Hypothyroidism, last outer third, pretty diminished, thin, and going away. Reactivity, hyperreactive in adrenal patients versus hyporeactive in hypothyroidism patients. Infections, they get sick all the time. If you've got adrenal fatigue, your body's trying to rest and repair, you will get sick frequently. Blood sugar, you'll have low blood sugar issues. GI. So you may have more tendency to go to the bathroom versus less with hypothyroidism. Sleeping. You will typically wake up from 2 to 4 a.m. on a regular basis if you have adrenal fatigue problems. Cravings. You will crave sweet and salty foods. Now that's half of America because of our diet, but pay attention to this because it does happen frequently with those that have adrenal fatigue. Heart palpitations are very common. And personality types. These are personality types such as type A and obsessive compulsive people. So here are just some things to take a look at to try to determine maybe if you have an adrenal fatigue problem. The other thing that you have to look at are blood tests. What we will find with blood tests is that you may have thyroid binding globulin levels that are very high, even though a TSH may be a little high, but T3 and T4 are normal. I don't want to confuse it with the testing, but thyroid binding globulin may be high for someone that has adrenal fatigue. Just remember that. But look at these symptoms. Go over these again. These are very common. And again, if you pay attention and try to differentiate these between hypothyroid symptoms, you will be able to see the difference. So if you're still having symptoms and you're being medicated, look into adrenal fatigue. So hopefully this served you well. Until I talk to you next time, eat well and be well.